Welcome, everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 282,577 confirmed cases of COVID-19 in Canada and 89,784 cases in Ontario. Chatham-Kent has 445 cases and Sarnia-Lambton has reported 380 cases. Michigan now has 236,225 cases, with 16,840 cases being in Detroit. Today, we are reporting 35 new cases of COVID-19 in Windsor and Essex County. 15 are agri-farm workers, 2 are healthcare workers, 5 are close contacts of confirmed cases, and 13 are still being investigated. We have had 3,044 cases since March. 2,783 cases are now resolved, and 185 cases are active and being followed by our health unit. 1 person is currently in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are currently 4 long-term care and retirement homes experiencing a COVID outbreak. There is 1 outbreak in the agri-farm sector and 1 community outbreak in a post-secondary student residence. We do have cases in the schools, but there are no schools in outbreak. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your number of contacts. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2-meter distance from others. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Download the COVID Exposure Alert app at canada.ca. Testing is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 testing and assessment centers: Windsor Regional Hospital, Olette Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you again for joining us today on Friday the 13th. The COVID-19 pandemic has infected now 51.25 million people and 1.27 million deaths worldwide. And just in USA, that case count surpassed 10 million mark with 237,731 deaths. Some countries are better than the others when it comes to the cases and the number of people dying with COVID diagnosis. And what we are looking here is how each of these daily cases of COVID-19 is increasing across the world. This graph shows some selected countries in comparison with Canada, and just to give you a better understanding of where things are and how the second wave is impacting the entire world, as we can see it. France is leading with the daily new confirmed cases per million count to increase at a higher rate in these select countries. There's a slight dip in the cases, but it will be too soon to see if they're actually plateauing at this time. They've put in some control measures, and we'll continue to see how those measures are impacting them. Italy continues to experience a very strong wave, and among all, Canada is still based on per million population case counts. We are doing relatively better with all these countries in comparison. Looking at the cumulative case count, which gives us a better picture of how we are progressing in terms of flattening the curve or if we are increasing at a rapid rate. Canada in the last couple of months are increasing at a pace which is concerning, and as we know in this pandemic that after a certain number of steady increase, they can see it can lead to a significant spike in number of cases, and there are a number of different modeling projections that are out there projecting what the case count in Canada could look like. When it comes to death, the first wave led to many deaths around the world, but with the cases increasing around the globe, we can see that the daily new confirmed deaths is also increasing in every country, and some countries are going in a very dangerous trajectory with the sharp increase in the number of people who are dying. Canada is standing in, it's somewhat still in a better shape with the number of deaths in that we are seeing and experiencing in Canada, but when we add that with the number of confirmed cases, this would be in line with what we are seeing, but we can expect the worst as we continue to move forward. Looking at the cumulative overall death counts and COVID-related death, we can see a strong upsurge in many countries, and in Canada, it's increasing, and it's on a trajectory to increase more. Looking at what's happening in Ontario in our second wave, as we can see that where our cases continues to increase across the province, and we're having a much bigger increase compared to what we have seen with the first wave. And right now we're almost coming close to triple the amount of the highest number of daily cases that we have seen in the province, which is a great concern for all of us. Right now there are still targeted areas, and the number of cases are increasing at a disproportionate rate across the province. But we know once it starts to spread, it's very difficult to contain, and we have seen the examples from some of the bigger jurisdictions in the region, and we are also now noticing somewhat a similar pattern in our region too. This data I borrowed from the provincial science table that presented their modeling, and it basically shows the hospitalization in Ontario, that how rapidly it's increasing, and we can see clearly starting from September, the hospitalization has increased significantly in the past weeks, up to 167%, and in just last 3 weeks, a 61% increase in the hospitalized case. With this trajectory and the modeling forecast, it will be very difficult to meet the demands, not only for COVID, but impacts other healthcare needs, such as any kind of trauma, heart attack, stroke, and other critical medical emergencies. Focusing just on Windsor-Essex, this is what it looks like, and in the past week we have seen a gradual increase in case counts, and we can see that in our epi curve that cases are starting to increase. We have reported 39 cases yesterday. We're reporting 35 cases today, and this is a concerning trend for our community. Looking similarly in terms of what's happening when Windsor-Essex with the number of COVID-19 patients hospitalized, we're still in a much better spot with very relatively few cases of COVID-19 admitted in our community, but we can also see the ICU beds that are occupied as a result of COVID-19. And as cases increase, we can anticipate that there will be hospitalization, there will be ICU bed utilization. And based on our local data, what we have seen is at least 10% of our cases would need some kind of hospital care, and some of them, and a small proportion of those people also need ICU beds. So we are, based on the number of background cases, based on the number of active cases in our community, we can anticipate that these cases will increase in the hospital system, and we are also will be pressed when we are talking about some of the other hospital services that are currently being offered right now, especially in second wave. First wave, all the non-essential surgeries and many of the services were canceled at the hospital, but right now the hospital is operating pretty much to meet the needs of the community, and adding further stressors with respect to COVID-19 patient will be a big concern for our community. Looking at the confirmed cases of COVID-19 by likely source of exposure in Ontario, what we can see is, and even comparing it with the first wave, is in the first wave, a lot of these cases were a result of close contact and outbreak with the very limited community transmission, and partly because of the lockdown measure that were implemented in the earlier phase of the pandemic. And right now, even with the second wave, when we're still many of the businesses and community is open, we are seeing an increasing trend of non-linked or community spread cases in the yellow, as we can see in this graph. Comparing that graph with what's happening in Windsor-Essex, we continue to see that most of our cases are acquired as a result of close contact, and some are acquired as a result of community transmission. It's at a manageable level that we can see in the community, and we definitely want to keep these numbers of non-linked cases or community transmission cases at a much lower number. And I just want to make a comment here, because we always, when we report cases, we do talk about how many cases are currently under investigation on a daily basis. But going back to all these information, all those informations are updated on our website and also on this particular graph. So if anyone is thinking about what happened to those cases that are under investigation, whether they were contact, whether they were travel related, whether they were community related, all that data is captured in this particular graph, up to whatever information we have available. So going back to some of these trends, we can definitely see that the trend is increasing compared to where we were before 5 or 6 weeks ago. Taking a deeper dive into our local epidemiology, and what we are looking at the weekly incidence rate, and as we can see throughout this pandemic, we have had quite a significant increase in the weekly incidence in the summertime, and then we did relatively okay in early fall, late summer, but now we're seeing that the weekly incidence rate is increasing. And still, it's not a critical point that would tip all these scales in a different direction. And majority of these cases are still close contacts or epi-linked, but we definitely have the opportunity to turn it around and bring it down to a level that we have seen before. But compared to the previous week, what we are seeing right now is our weekly incidence rate is at 19.1 cases per 100,000. And if you recall, a couple of weeks ago, we did talk about that our weekly case rates were close to 5 point something, if I remember, in single digits. So we have seen a significant spike in the number of cases, which is something that's concerning for our community. And on top of that, when we are seeing at the cases, we have to look at the percent positivity, that how many cases, how many people who are getting tested, and what the percent positivity rate in Windsor-Essex look like. And as you can see with the green line, which is indicating the percent positivity of all the Windsor-Essex tests that is conducted, we can see that it is increasing, and week over week percent positivity is increasing, even with the number of tests that are being conducted right now. So now, even though we're conducting roughly the same number of people, but the percent positivity is increasing. And as of November 7th, our percent positivity is 1.5%. And between November 1st and November 7th, we conducted roughly around 5,000 tests in our area. So another concerning trend that we are seeing right now is the effective reproduction rate, or R0. And as of November 11th, our median effective reproduction rate has increased to 1.66. And if you recall, in the last couple of weeks, we were close to 1.2. So we have seen a significant spike in the effective reproduction number in the region. Looking at the active COVID-19 outbreaks in all settings, as we can see that we have four active outbreaks in the long-term care home and retirement setting, and 1 outbreak in the workplace setting, which is concerning to which is adding to the case count, and also pointing out to the trend that if we have long-term care home and retirement home in outbreaks, those are the most vulnerable population that may end up in hospital setting or require some ICU support. So something that would be critical for us as a community to be aware of, that what's happening with all these long-term care home, and the appropriate controlled measures and the community spread that we need to contain to protect our vulnerable in the community. So this graph is showing that the percentage of new cases of COVID-19 acquired in the community and 7-day average, and this is not the number of cases per se, it's the proportion of cases that are acquired as a result of community transmission. So if you have more cases and then a number of these cases are close contacts, you will see a decline. So this is exactly what we are seeing, because our cases right now are linked with the long-term care home, with the agri-farm workers at this time, which are generally coming in from as a result of close contact, and the number of community transmission cases is seeing a slight dip. But overall, in terms of the absolute number, it is somewhat similar to what we are seeing, and we also want to make sure that those numbers continue to go down with the number of cases that we are seeing as a result of community spread. So from a health care system capacity, this is what it looks like. Our current capacity is at 89%, and in recent days we have seen that the thresholds, we're touching the 90% threshold, and it doesn't necessarily mean that when we're talking about these 90% capacity, it's all related to COVID-19. It's a combination of everything that we are seeing. Similarly, in the ICU bed capacity, we are at 72% capacity, and we are seeing some ups and downs. With respect to ventilator bed capacity, we are currently standing at 31%, and some ups and downs in the community as well. From a public health capacity perspective, what we are looking at is between November 3rd to November 9th, 86% of our cases and 90% of contacts were contacted within 1 day of being reported to public health. And as we are getting more increase in the number of cases from the agri-farm sector and our follow-up that is needed, the number of contacts each of these cases have, there may be some capacity challenges that we can anticipate with our sudden increase in the number of cases. So our recommendations for individuals have been, and it's worth reminding that again and again, that stay home if you feel sick, or even if you have symptoms that are mild. And as trivial as it sounds, washing your hands regularly with soap and water, it's one of the critical pieces that we can do to protect ourselves from even if we are touching a contaminated surface, or if we are coming in contact with anyone with COVID. And if you are sick, if you're coughing and sneezing, always try to cough and sneeze into your sleeve or tissue instead of spreading it to other people. Always keep your surface clean and disinfected. Physical distancing is one of the most critical piece to ensure that you are not coming in close contact with someone who could be sick with COVID. So anyone who doesn't live in your household, please always maintain your 2-meter physical contacts with them at all time, and wear a cloth mask if physical distancing cannot be maintained. When we're talking about our socialization, we would like to remind people that please limit your close contact to your household members only, and maintain your physical distancing and wear a mask when you're in contact with anyone else. And always, as we know throughout this pandemic, that the cases increase mainly in indoor settings. So avoid indoor gatherings with people who do not live with you, and try your best to connect with friends and family virtually. A number of recommendations for how you can still stay physically active while in this time of pandemic. And in summary, what we can say is our case count in the region is increasing at a rapid rate, which is a concern for our community. And most of these cases are resulting from close contacts from the outbreaks that are happening with the farm cases that we are seeing. And we need to talk about the social and private gathering that needs to, it must stop immediately, because that's one of the things that is driving some of these numbers in our region. And we know there are 4 long-term care home and retirement home that are in outbreak, and one farm is in outbreak. Enforcement of COVID-19 measure is critical to continue to contain the spread in our community. And we need some targeted action to control the spread of the disease in the community. And later today, I will be issuing a letter of instruction pursuant to Ontario Regulation 36420, rules for areas in Stage 3, Schedule 1, Subsection 2-2. And this will set clear expectation for the community, and also allow the local bylaw officers, police, and our tobacco and vaping enforcement officers to strictly enforce these measures and charge people and businesses for non-compliance. We always want to work with our community and our stakeholders for compliance, but after 8 to 9 months in the pandemic, this is not an excuse for anyone to say that they don't know what they're doing. Our staff have worked tirelessly to provide all the tools and resources. Our community partners have worked tirelessly to provide that education and support to the community. And our website contains wealth of information for anyone who's looking for these measures and how to keep themselves safe and how to be in compliance with all the regulations and that are currently in place. It's time for all of us to review these guidelines, the restrictions, and we should enforce it strongly. I hope everyone will do the right thing and follow the public health guidelines. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with the Windsor Star.
Yes, good morning, Doctor. With more cases in the agri-farmer sector and long-term care retirement homes coming up again, will any proactive testing measures be implemented again? Is it time to call the provincial task force back to the farms? Are we looking at any of those things?
Well, the provincial testing guidelines and criteria is out there, and as we talked about before, testing will give you what's happening right now, but what we need to focus more is on the prevention side. Our background case rates are not as concerning as we're seeing in some of the area. So I want to make sure that we are focusing on the problem. The problem is prevention and the compliance of these businesses and these farms, and it's unfortunate that we're still finding deficiencies despite our proactive inspection of these farms. Our team is out there. Our team has never stopped working for any period of time in this pandemic. Before getting into the fall season, our health inspectors are doing proactive inspection to these farms to provide education and to provide support to make sure that they have all these requirements in place, and they are following all these public health measures. And despite all of that, we are seeing some of these deficiencies. So we want to bring it forward that it's not an excuse. I think all of us, individual, businesses, everyone has suffered enough in this pandemic, and it's time to take our own responsibility and do the right thing and take action. It's not a problem that public health can solve. It's not public health's responsibility to fix everything that's happening everywhere else in the world and everywhere else that each of these industries and businesses are responsible for. We have to be serious about it, and we have to own what it's ours and do the right thing. And as I mentioned, we are looking for a strong enforcement measure to contain the spread, and any businesses, anything, anyone, any person, any social gathering, anything that may be in violation of these measures, they will be charged, and a strong enforcement will happen.
I understand you're going to release the details of the order later today, but can you give us a hint of what will be able to be enforced by law enforcement, by law officers that people they haven't been able to charge people for up to this point?
Well, I think it's just the clarity of the instructions of what is the expectation. And as I said, if you are having a party in your house it exceeds the allowable indoor limits of more than 10 people, and doesn't matter what kind of loophole that people are looking for by combining or looking at different ways, if someone is found guilty of that, they should be charged, and they should be charged immediately. There is not time anymore for us to continue to do the education. We need to take that action. And with the letter of instructions clearly out there under the authority of the Medical Officer of Health, it would allow them an easy enforcement of these, all under the Emergency Management or Reopening Ontario Act that is currently out there. It will give them the ability to charge those people. And when we're talking about the businesses as well that are currently open, we have dealt with, and Teresa has provided many of the update in terms of the compliance about the mask, the compliance about the people singing and dancing, and the business maybe not following those precautions. All of these things will be easy to enforce and easy to charge people and businesses if they are in non-compliance.
So it sounds like leniency is out the window. People have received enough education. They should know what they're doing by now, and they will no longer be receiving warnings.
In some way, yes, that is correct, because we're in this pandemic now. It's a global pandemic. It's been 8 and 9 months, and if somebody claims that they don't know what these measures are or what their expectation is, it's unfortunate, and it really concerns me when people are still acting like they don't know what they should or what they shouldn't do. There are a number of tools out there. There are a number of opportunities for us to educate, and a lot of that is happening right now. It's time to take action, and it's time to own everything. It's not time to say that, well, you tell me what to do. No, it's your responsibility to find out what your obligations are too. We have all the tools. It's not practically possible to pick and hold everyone and then educate each one of them. The tools are out there. We have taken a number of measures. Both Teresa and myself, we are sitting in front of you regularly, if not even every day, but every other day, or there were times when we were here every day to provide that education. It's time to take action right now.
Thank you.
Any questions from AMA 100?
Hi, Dr. Ahmed. I'm just wondering, as it relates to the modeling that was released yesterday from the province, obviously those are some pretty staggering numbers, and we are seeing our numbers increasing here in Windsor-Essex. So in terms of trends, where do you see Windsor-Essex fitting into that provincial modeling data with where we're going right now?
Well, we are seeing a late surge compared to some of the other larger jurisdiction, and I can see that our numbers, as you know, back in the summertime, our case rates were higher than any other region in the province, and with strong measures, with strong work with a lot of our community partners, our health system partners, we all worked tirelessly to bring that number down, to contain the outbreak, the largest outbreaks that we have seen in the agri-farm sector. Many critical outbreaks that we have seen in the long-term care home and retirement home, and we still were able to come out of it and saved many lives. But what we are seeing, the trend, we are generally a little bit behind that what happens in Toronto and some of the other areas. So our case counts are showing similar trajectory, that our case counts are increasing. And once it starts to spread in the long-term care home, we already know that 4 of these long-term care home are currently in outbreak. We know once it starts to spread in the agri-farm sector, the number increase rapidly. And then many of these workers many of these people who are in these sectors, they also go out in the community too. They will expose other people, they will expose other businesses, and they will expose other children. And then you will see pockets of all these cases spreading in so many different sectors, and potentially leading to, and knock on wood, I definitely don't want to be in that position, but it could easily lead into a school outbreak. It could easily lead into workplaces outbreak. It could easily lead to our health system, which will be unable to maintain any of that. We need to go back to where we were before by canceling all these non-essential surgeries. We need to cancel some of those other non-essential work that is needed. But that doesn't mean that those services or those health system, nobody wants to go for surgery. Yeah, you can delay some of those surgeries. Yeah, you can do that, but for how long? And is it worth because people are not following what they're expected to do? Or is it something that we should all own as a community and take the responsibility to act in a responsible way to keep everyone safe and be responsible? I think it's really critical that we get that message. And I'm really disappointed every time when I'm hearing about all these nonsense about again and again. It goes back to, it's simple, it's flu, it's nothing but flu. And I'm tired of that. And I think anyone who's thinking about that, I think they're also equally to blame. We need to get back to going back to what science is and what these diseases can cause. And some of the data I've shown in other countries as well, they went into the same pattern. They talked about, yeah, it's fine, let's go open up, and look at what's happening everywhere and across Europe. And they are in lockdown. Do we want that? And it's because of those irresponsible behavior and irresponsible messaging. This is what's happened, and we don't want to be there, and I think it's time to act right now.
Okay, thank you.
Any questions from CBC?
Yes, hi, Dr. Ahmed. I'm just wondering, will you be going beyond the provincial categories that are recommended right now and impose stricter guidelines here? And if not, what will it take for you to do so?
So right now, what we're looking at the numbers, and I know the province updates their status as well, and would be interested in seeing where they will put us, and I can easily say that whatever measures or whatever category that they would put in, I think our community needs a little bit more than that, and I will be looking at what their assessment is, and that's why some of these additional recommendations and the letter of instructions you will see later today based on what we hear and what we see from the province.
And then we're hearing that there are 30 cases coming out of Windsor. Is this an accurate number, or can you confirm the number of cases resulting from that residence outbreak?
No, I think what we have reported is the one that we know, and the number of close contacts that we identified was total of 18, and we don't know where this number or where this speculation is coming from. There is no evidence to it. But having said that, there are always people who are currently being investigated, and there may be other activities that are happening. But what I can tell you, especially from the last outbreak that we have declared, the total number was 18 as per our investigation, and we do not have anyone else who is currently positive. And if they will be reporting it back to the community.
Okay, thank you.
Any questions from Blackburn?
Yeah, I'm just looking to clarify again. I know you're sending something out later today, but are there additional instructions, additional charges that are going to be able to be laid later, or this is just reinforcing what's already been out there?
So it's a combination. So I think what we can see from the provincial framework and what is allowed and what is not allowed in the green zone, and as of this morning we are still in the green zone based on the provincial framework, and it allows certain activities, and what we are looking for is to see where the province puts us, and then if there are additional restrictions that we feel based on our community needs that is needed, that goes beyond what the province is recommending, that's the one that we would be putting in forward, and the rest is a strong focus on the enforcement.
So are you expecting us to be moved forward? When do they usually update their list?
Well, they do it sometime during the day, generally by noon or 1 o'clock, and the framework that they have provided and the numbers that I just presented, I think if you're just focusing on the number, my guess is yes, it will be critical for us not to stay in green. But again, that's the decision that the province makes. So we'll have to wait and see what the province decide. But just looking at the numbers and what their thresholds are, I think we have passed those thresholds. So we'll see what the province do.
Thank you.
Any questions from CTV?
Good morning, Dr. Ahmed. I'm just wondering, could you be more specific what additional restrictions that you might look at recommending?
Well, as I mentioned, that we are waiting for the province to see where they put us and what does it mean. We do have some work. We had a great conversation with all our local leadership yesterday. We talked about some of the challenges and some of the trends that we are seeing in the community, and based on that, we have put together some recommendations, and we will release it once we see what the province decides, and you will see that firsthand.
Given the rising case counts, do you think it was a mistake to let the bars stay open later?
Well, I think I can't say that right now. That's what is in the provincial reopening framework, and we are looking at all the tools that we can provide and follow some of these data, what these data say, and we'll continue to monitor that.
Thank you.
Any further questions from the Windsor Star?
Yes, doctor, just for clarity, what you put out this afternoon will depend on what the province announces for our region in sometime today.
That is correct, yes.
Okay, so theoretically, if the province tightens restrictions here, you have your own tight restriction framework to release, and if we stay in green, you'll put something else out that works within the green framework.
That is correct. So whatever category that they put forward, and based on our local evidence, based on our local needs, we'll try to see, as I mentioned, we already have discussed some additional recommendations, and if the province moves us forward, then some of these recommendations will already be covered. But if, let's say, the province doesn't move us, then we will have to go back and make sure that we are putting some of those measures in place to keep everyone safe and to keep the case counts low in our community, so that we can continue to enjoy what we have right now and go back to the number of cases that we were happy to report in single digits, less than 5, or maybe even no cases. So I think it is critical that we recognize that what is at stake, and we work together to make sure that we get there.
And I understand are you being purposefully vague because you do know what the province is going to announce for us later today, or do you wish that or is it not that case and you wish the province maybe would tell you ahead of time what was coming?
Well, as I said, I'm just following the numbers, and obviously we provide our recommendations as well, and we know the province they have their own criterias too, and we are basically told sometimes, and what we are waiting for right now is to see what the province make the decision, and based on that we'll add or subtract however it goes with our letter of instructions.
Okay, thank you.
Any further questions from AM 800?
I'm okay, thank you.
Okay. CBC?
Yes, Dr. Ahmed, we've recently had double-digit numbers for cases that are still under investigation. Does this maybe hint towards or tell us about delays in contact tracing or a strain on your staff? And if so, do you have any plans to kind of increase that capacity as caseloads maybe grow?
I'll pass it on to Teresa to answer this question.
So the last few days have been a struggle for our staff as they are attempting to address all of the new cases and do the interviews, which can sometimes take up to an hour or more per new case. And so we do have a group of nursing staff that have been primarily doing this work. And early on, we did redeploy other staff from other areas. We've slowly tried to release them back to other duties, but based on our numbers and the increased pressure of the case counts being so high, we'll probably redeploy staff back again to help with this surge of cases and also the high-risk contacts. So even though there are no outbreaks in schools with cases in the schools and the release of cohorts, we have a lot of high-risk contacts that are in isolation as well. So you may hear about the case counts, but the high-risk contacts are pretty significant, and that further puts strain on our capacity.
Thanks. And just another question. I believe it was the start of this week where schools made that transition where students could switch their learning mode. We did see quite a number of students return to in-person classes. Do you have any sort of thoughts or recommendations on I guess that, just as more students did decide to kind of make the switch to in-person, and as we're seeing cases rise, should it maybe have gone the other way?
No, I think what we have seen, especially from the beginning of fall season when the children went to school, I think the school really put all these efforts to keep their school environment safe, and as a result, some of the areas in the province have seen outbreaks in the school, but knock on wood, our area, we haven't seen any outbreak in our school system. I think some parents in the beginning were maybe not sure about whether to send their kids or not, and not really understanding that how it will work out. But after seeing it at least a month or a half or 2 months in, that the schools are a relatively a safer environment, and adding the benefit of in-person classes and the learning environment, maybe they're looking at the benefit of it. So it's also now important for the schools that now you have more students, and more students brings more challenges, and more challenges means more enforcement concerns. We cannot be complacent right now, and I think it is important that not only the school, parents, but also the students, they are following all those guidelines. And I want to recall, like in the beginning, there were a lot of emphasis. Everyone was really concerned. Everyone was following it, and it's human nature. Once we start to follow certain things, we start to be complacent, and it's not the time to be complacent, especially when the community cases are increasing. So I don't necessarily attribute it that way. I do feel that I think some of these parents felt more confident and comfortable with the school cases, and that's why they're sending. And I think we can still create the safe environment in the school, and that's where some of these restrictions and enforcement are necessary, that people need to do the right thing and follow all these guidelines and recommendations.
That's great, thank you.
Any further questions from Blackburn?
No, thank you.
CTV?
No, thank you.
Okay. So before we finish this broadcast, I just wanted to remind about about our website and the pandemic status update. We will be, and as we have constantly been reviewing some of these, our local pandemic status indicator as well as the provincial status. So expect some changes later today, as well as we will post more details in terms of what these restrictions mean, and make it easy for everyone to understand that based on whatever alert status we are, what is the expectation. And some of these things are currently being developed. So later today, you will see some of those changes on our website as well. Thank you.
Thank you.